Knock, knock. I'm washing my hands. And do I have your permission to film this video today?
Sure.
Okay. And how should I address you?
Kevin.
Hi, Kevin, I'm Laura. I'll be the nurse practitioner performing your abdominal exam today.
Okay.
Just a few silly questions to start off. Can you tell me where we are right now?
We're in the living room.
Okay. And what year is it?
2025.
Okay. And on a scale of 0 to 10, are you experiencing any pain today?
No.
Okay, great. I'm first just going to inspect your abdomen. If you don't mind just raising your shirt for me. Perfect. The abdomen is flat, symmetric, it's well muscled. The umbilicus is central, midline. Everything is symmetric. I don't see any obvious masses. The skin is intact. No lesions, tenderness, rashes, or obvious deformities. And I'm just going to have you lay back on your back on the exam table here. And if you don't mind, lift your shirt up again for me. And then if you can raise your head off of the exam table for me. And as you do that, I don't see any signs of any hernias. There's no evidence of diastasis recti or obvious deformities or masses noted. I'm going to next listen to your belly for your bowel sounds. You can just breathe normally. Great. And I hear clicks and gurgles. There's positive bowel sounds throughout all 4 quadrants. I am next going to percuss your belly. Just listening for different bowel sounds. I'm just going to be tapping on your belly. Great. And I hear dullness over the liver and spleen, tympany over the stomach and intestines, as expected. Next, I'm just going to measure the span of your liver by using that same method, percussion. So I'm just going to be tapping on your belly. Great, and I'll use my pen here to mark where I hear the change from tympany to dullness. And then I'm going to do the same thing from resonance to dullness up on the upper border of the liver. So right about here, and I'll put another mark on your liver. And then I'm going to lightly palpate your abdomen. So I'm just going to press. You let me know if there's any tenderness, okay?
Okay.
Any tenderness?
Nope.
Great. And the consistency was smooth and consistent throughout. No tenderness, no resistance noted, and no obvious masses were detected. And I'm going to do that same method, but just a little bit deeper this time using 2 hands. Any tenderness as I press?
Nope.
Great. Again, no tenderness, no resistance, and no obvious masses were detected. Next, I'm just going to feel for your gallbladder. Same thing, let me know if you feel any tenderness, okay? Any tenderness here?
Nope.
Great, and I'm gonna press in as you take a big deep breath in. Take a deep breath in. As I press, any tenderness?
Nope.
Great. So the patient has a negative Murphy sign, so there's no evidence of cholecystitis or inflammation in the gallbladder. And the gallbladder was not felt on palpation, which is normal. Next, I'm just going to feel for your spleen. So I'm going to reach across to your other side and gently lift up your back while I press. Any tenderness as I press?
Nope.
Great. Again, the spleen is not detected on palpation, which is a normal finding. There's no signs of inflammation or enlargement of the spleen. Next, I'm gonna feel your kidneys on each side. I'm gonna use kind of that same technique. So same thing, let me know if you have any tenderness. Perfect, and then I would have the patient, if I was on an actual exam table, I would be able to switch sides and feel the kidney on the right side. But for the purposes of this couch, we're gonna feel here. Any tenderness?
Nope.
Great. The kidneys are not felt. No tenderness means we likely don't have any signs of inflammation or infection in the kidneys. Next, I'm just going to perform to palpate your aortic pulsations to see if there's any evidence of aortic aneurysm. And no obvious pulsations or evidence of aortic aneurysm are felt on palpation. Next, we're going to perform a couple of tests. The first one is an Ilias-Psoas test. It's going to detect any inflammation in that muscle or signs of appendicitis. So I'll have you first raise your right leg off the couch here, and I'm going to apply some pressure down. Try to resist. Any tenderness or pain in your belly?
Nope.
Great. No evidence of appendicitis. And then we're going to perform the obturator muscle test. So I'm going to have you flex at the hip and the knee, all support at your knee and ankle. And I'm going to bring your leg outward and then inward. And then inward. Any pain or tenderness as they do that?
Nope.
Great. So we have a negative obturator sign, which likely indicates that there's no signs of pelvic abscess or appendicitis. And then finally, I'll have you sit up, and I'm going to perform a test for CVA tenderness. So I'm just going to use my fist to strike the right and left sides of your back. We're looking for any signs of kidney inflammation or infection. Here on the right side. Any pain or tenderness?
Nope.
And on the left.
Nope.
Great. So negative CVA sign. And that concludes our exam today. Do you have any questions?
Nope. Thanks.
Thank you for your time.